Now I'm going to switch gears just a bit and talk about the role of care team communication. And I can't talk about communication before I talk about the reason why communication is so important. And that's really because it's the #1 cause of sentinel events in our country. I'm sure many of you saw this study come out last year through the CDC and the BMJ that reanalyzed medical errors and their impact on causes of death in the United States. And while we don't include medical errors on the CDC's top 10 list of deaths, if it were, it would be third on the list of most common deaths in the United States, which is astonishing because if you think about it, these are only medical errors that are reported and quantified. And in my experience, most medical errors are not reported and hard to quantify. So I shudder to think of where this would be on the list if we were able to capture all medical errors. Other than its impact on human life, we're well aware that the cost of medical errors is astronomical. There's citations of various numbers. This one that I pulled is $17 billion of avoidable costs a year. And in most cases, it all comes back to the way that we communicate with each other or the way that we don't communicate with each other. But the real story here is on what this means in dollars. And so this is just an example of a $1 billion revenue hospital and what it could mean to the bottom dollar to have all these programs at risk should you not perform to the standard that avoids you from getting penalty. And you can kind of see what this looks like. The withholding amount is staying at the 6% through 2021. And so at least this many dollars will be at risk.